Now, I want to talk about special bladder injection. So this is like a mode of giving drugs to the bladder. All right. So this is what is as a trans-trigonal phenol injection. Trans-trigonal phenol injection. Okay. Phenol injection. Trans-trigonal. Okay. So you are giving injection, and basically it's through the trigone, okay, of the bladder. So trigone is basically, I think it should be this triangle, hence the name trigonal. So you are giving injection around this area. So why? Okay. So it's a minimal invasive procedure. It's used to treat urinary incontinence rather, particularly in children that have neurogenic bladder. Okay. So chemically, you are giving the phenol injection because you want to denervate the bladder trigone, because you want to reduce how often this is contracting. Okay. So the procedure involves injection of phenol. It's a neurolytic, that's a nerve destroying agent, into the trigone area of the bladder. So that's a triangular region between the ureteral orifices and the bladder neck. Okay. So you basically use this as a landmark, that hole there and this hole there. So if you connect them, then bring it down like this. Okay. So indications: if somebody has neurogenic bladder with detrusor overactivity, the bladder is overcontracting, refractory urinary incontinence, then urgency of frequency due to what? The detrusor muscle is hyperreflexing. Okay. So phenol causes chemical neurolysis of the nurturing proteins and destroyed nerve endings in the bladder wall. So this reduces afferent nerve signaling and detrusor overactivity. Okay. So this will now lead to improved bladder compliance, and there's reduced incontinence episodes. So cystoscopy is performed. That's a procedure. You have to look into the bladder first. Okay, look at the condition. Now a needle will now be passed through the cystoscope. Okay, so it's through this device that you pass needle inside it to inject it, right? So multiple small volume injections are made to ensure even distribution. Patient is monitored, okay, for post procedure for urinary retention. So you don't want it that from urinating too much, the patient is now tilted into retention. You understand? So you're just trying to make everything balanced. So risk factors: it can cause urinary retention, can cause hematuria, that's blood in urine, can cause bladder irritation and infection, and all of that. Okay.